Taking medicine correctly is very important, obviously, and Mayo Clinic Health System staff work to make sure every patient understands how to take their medicine before they leave the hospital.
News 8 Now's Jordan Frebstad explains how Mayo's Meds to Beds program works.
When we leave the hospital, we usually have medicine that we have to take, but what about people who don't speak English? Interpreters here at Mayo Clinic Health System make sure that patients who leave the hospital take their medicine safely.
Making sure that communication is there for them to walk out the door and be able to follow through.
There's a medication delivery service offered to our patients that are in the hospital.
Meds to Beds is a program that gets medicine to patients along with the knowledge on how to use it before they walk out the door.
How many times they're supposed to take it, why they're giving them that medication.
Knowledge Colleen Kudo says
As part of the medical team,
is vital.
Like the pharmacists say, that readmission rate is high if you're not 100% sure about how to take your medication.
When the instructions are written in English,
We'll write little notes about the medication and stuff. And,
non-English
be like,
speakers
"Do you
rely on
understand my
people like
chicken
Kudo
writing? Can you read
and
this?"
Dora Zatina.
fun, we call ourselves kind of word nerds.
Language is complicated.
Spanish alone has 53 dialects.
And our Spanish population is actually bigger than our Hmong.
And often forms a barrier for people.
There's no word-to-word correlation in English to sign language.
Zatina says many Spanish patients would rather go without their medication than stand in line at a pharmacy.
They don't want to slow down the process of other people waiting behind them.
Kudo says these people often feel like a burden.
And that's an uncomfortable feeling when you don't feel good anyway.
Meds to Beds forms a bridge over this obstacle.
We bring them right up to their rooms so they have them going home.
Zatina not only speaks Spanish,
I am starting to see a huge increase in people from Puerto Rico.
but she understands the culture too.
Yeah. It's a cultural thing that they won't ask questions. They're just nod and agree. So we have to be able to understand when we need clarification.
Their voice helps patients feel at peace
I went up and interpreted for a girl up in Eau Claire.
when they leave a doctor's care.
It's priceless. That feeling to me is just like it's a victory that I get to go home and take that with me.
Patients may speak different languages and live inside different cultures,
When they think an interpreter is going to be there.
but everyone shares the desire
You go by context, you go by meaning, you go by
to be
what color is it,
understood.
what is it.
It's a great job to be able to empower patients.
Mayo Clinic Health System offers several language interpreters in person, but the languages that are not available in person, they do have services available online. In La Crosse, I'm Jordan Frebstad, News 8 Now.
And we will post a link to those language services that are offered at news8000.com.